Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is colorectal cancer, which is the second leading cause of cancer death in the United States for both men and women. We'll be talking about colorectal cancer in order to heighten awareness of preventable health problems. Joining us today is the case manager for the Harford County Health Department Cancer Prevention Program, Megan Kasem, and gastroenterologist, Dr. Peter D. Park. Welcome to our show, and thank you for being with us today.
Okay, thank you for inviting us.
Thank you. So I'm so excited to speak with you today. Do you mind just taking a second to introduce both of yourself? Dr. Park, if you can go first.
Okay, yeah, my name is Dr. Peter Park, a gastroenterologist and a senior partner at Harford Gastroenterology Associate in Abingdon, located in Harford County. I've been in practice, practicing gastroenterology for 20 plus years and caring for exclusively Harford County residents.
Wow. Megan?
Hi, thanks for having us on.
Thank you.
I work for the Harford County Health Department in the Cancer Prevention Program. I've been here since June, and I have a 20-year nursing history, and
Wow.
This is an amazing program, and I'm really excited to have this opportunity.
Great, thanks. So let's just delve right into it. Can you guys tell me a little bit about colorectal cancer, and why is it important that we're talking about it today and bringing awareness to it?
Well, as you alluded to, colorectal cancer is very common, and we deal with it very frequently. And as you mentioned, it's third most common cancer occurring in the United States, men and women. However, it's the second most common cancer-related mortality, both men and women in the United States. And it is very frequent, and it can be very preventable. So that's why it's important to talk about it today.
Yeah, and I know that it's also a really common cancer too in Harford County as well. So again, this is bringing importance on why we're talking about it. Can you also tell me a little bit about the screening for colorectal cancer? What are the tests you can get to kind of test for colorectal cancer?
As far as the screening for colon cancer, there's a different way of categorize it. From my understanding is it can categorize it two different ways. Mm-hmm. One is a first step screening procedures. Mm-hmm. Colonoscopy is the only direct screening procedures. We can directly look at the colonic mucosa, detect for any kind of polyps, which is precancer lesions, and we can remove it at the same time. And second step is the two-step procedures, including stool studies and the imaging studies with X-rays, or sometimes the blood studies. And stool studies have gotten popular recently, include a fecal called blood, fecal immunochemical test is called FIT test, or most recently Cologuard, which is a multi-targeted stool DNA testing, which has been gaining a lot of popularity. And imaging studies include barometer and virtual colonoscopy, or also called colonoscopy CT colonography test, and finally with the blood test, which has been introduced but has not really gained popularity yet.
So I kind of want to talk a little bit about the process for colonoscopies. I know it's a really tough subject for a lot of people to talk about, and I know that they've also kind of changed throughout the years. So if you guys could just kind of give me a little bit of that background on, what's the process for a colonoscopy now? What's the prep like? Things like that, so we can kind of educate the audience.
Well, since we deal with the colonoscopy, I'll go first. Yes, we do hear a lot about the difficulty of taking the preparation. Unfortunately, colon is about 5 feet long, and it stores a lot of fecal material. So that needs to be washed out. So I use the example of almost like a power washing your deck. A little bit of drip liquid over a long time, it just does not work. So it has to be huge volume in a short time period, or the forcibly eliminated. So that's the worst part of it. But over the years, the bowel preparation has improved. It used to be large volume, like a whole gallon. in 4 hours. But now we do the split dose of much smaller amount. And the screening process is for the people who have no symptoms, and the colonoscopy is one of the screening process. And bowel preparation is the difficult, but once you get to finish that bowel preparation, everything is easy. I do all the work. Patient just relax, and I do all the work.
Do you think there's any, what do you think there might be like stigma around people getting a colonoscopy? How can we kind of break down those barriers just a little bit?
So I think it's really important to make the patient feel comfortable and give them as much information as possible. We were just talking about the bowel prep, and I call them the night before, and for if they're in our program, and I let them know to prepare themselves that they're going to be on a clear liquid diet and what that means, and then some suggestions like non-red Jello, so nothing red, and Gatorade, and chicken broth or some sort of, and just prepare them. So preparing a patient for what they're going into so they have all the information they need makes a huge difference, and it makes them feel comfortable to have physicians like Hartford Gastroenterology, and they're amazing, and they make them feel comfortable in the office. And then if they're in our program, we make them feel comfortable too. So breaking those barriers and giving as much information as possible is really important to have them go in and know exactly what's going to happen. I think that helps them a lot.
Yeah, I think that compassion, just letting them know, walking them through the process is just going to make it 10 times better and more accepting for people too, especially because that process is not easy for anyone. But it's a good thing that things have evolved throughout the years, and it's been a lot easier. Let's talk a little bit about the risk factors for colorectal cancer. So are there environmental ones, biological ones, physical ones?
Colorectal cancer is pretty much well known by many people. There are several risk factors, one that you can change something about or something you cannot change. So that includes a familial history or previous medical history, and there are certain genetic conditions that you are predisposed to developing colon cancer, and also family history of colon cancer or the colon polyps. But when we use family history, generally it means a first-degree relative, like mother, brother, sister, rather than your cousin or the great-grandmother. And a medical history that includes diabetes or sometimes inflammatory bowel disease, particularly affecting colon, ulcerative colitis or Crohn's colitis. Environmental factors, which is what we need to focus on, try to work on, which is sedentary lifestyle, obesity, red meat consumptions, alcohol consumptions, and tobacco consumption. Those are the main factors.
So definitely eat your fruits and vegetables and work out, but then there is also that genetic, biological factor that could also contribute to colorectal cancer.
Absolutely.
I think we really need to always continue to push that physical activity aspect too as well, and the healthy eating, especially because our diets also have changed throughout the years too. So you've also said that there's an increased risk of colorectal cancer if you had other gastrointestinal disease. So was it diverticulitis is an option, or Crohn's disease too as well? That could also lead into colorectal cancer?
Not so much of a diverticulitis.
Okay.
Diverticulitis is very common disease affecting many patients, particularly as you get older, you are more prone to develop diverticulitis. But diverticulitis itself does not increase the risk of a colorectal cancer. But Crohn's disease, definitely, if that involves a colon, as well as ulcerative colitis. Okay,
wow. So how about the symptoms and the signs for colorectal cancer? What are some things that the audience needs to look out for to say, hey, I think I should go get checked? Also, what would be like that age range too as well that we would be kind of concerned with?
So 95% of all colon cancers are diagnosed 50 and over, but they just changed the age for recommendation for screening to be 45 to catch that 5%. They're, flank blood when you go to the bathroom, changes in bowel habits are definitely some signs and symptoms. Bloating, GI pain and upset stomach. And a lot of times you won't have symptoms, and that's really important. By the time you have symptoms, sometimes it's too late, which is why screening is very important, because a lot of the times there's no signs or symptoms, and it's there. You know?
So then it's again, it's really important that we push that preventative aspect of getting, you know, your colonoscopy, going to the doctor, seeing your primary care specialist, talking about your symptoms. So we really need to continue, I guess, to make sure, especially if, you know, there might not be any symptoms, we should really push to kind of get that testing and that screening done for sure.
I would like to also just mention one symptoms that we need to focus about is many patients will have some symptoms related to colorectal cancer, but there are some people who have absolutely no symptoms. So having not having any symptom does not mean that you don't have any problem. So that is a very important point.
That is a good point. So how about the disparities with colorectal cancer? I know that I think we mentioned earlier, is it more common in men than women? Is there a reason why there might be more common signs in one than the other?
I think overall the colorectal cancer occurs both men and women, but men tend to have a higher frequency than women.
Okay.
And you know, scientists have looked at it why, but I think most people think that it's because the men tend to have more exposure to the risk factor we talked about.
Okay.
Obesity, smoking, alcohol consumption, and those type of things.
That's interesting. Let's talk about the treatment options for someone diagnosed with colorectal cancer. What are the differences in the treatment stages when we talk about maybe stage 1 colorectal cancer versus stage 4? We just kind of talk about, you know, what is out there as treatment-wise if someone is diagnosed.
Yeah, it depends on the staging of the colorectal cancer at the time of diagnosis. Rarely I've seen some patients who come in for asymptomatic screening colonoscopy and they tend to have a large polyp. And we remove it endoscopically, and that is confined to the inner side wall of the colon, and that is curative. Therefore, colonoscopy will fix it. However, many times, sometimes it involves a little bit deeper layers, so a little bit of the local area of the colorectal cancer that requires a surgery.
Okay.
And at the time of surgical resections, if that involves a little deeper layer or lymph nodes involvements, that requires more systemic chemotherapy. And stage 4, the most distant disease, if that unfortunately involves other organs, sometimes surgery itself will not fix it unless there's a signs of obstruction that we have to relieve the obstructions. However, if there's a distant organ involvement, we have to provide systemic chemotherapy by oncologist.
And what's the 5-year survival rate for someone who has been diagnosed with colorectal cancer?
I think overall the colorectal cancer prognosis of 5 years about 60 to 70%, but earlier stage, if there was confined to inside of the colon mucosa, resection is a 95% plus. And if the local disease is about 90%. However, if there's a distant metastasis, meaning involving other organs, that 5-year survival rate drops down to 15%, unfortunately.
Wow. So again, that importance of getting screened, getting tested early on, because the earlier we find it, the higher the survival rate we would have.
Absolutely, yes.
So I kind of want to talk a little bit about the CPES program that's offered at the Harford County Health Department. Megan, is there, can you give us like a background of what's the CPES program, services we have to offer?
So the CPES program is funded by the Maryland Cigarette Restitution Fund, and it stands for Cancer Prevention, Education, Screening, and Treatment. And they are cancer prevention and early detection services throughout Maryland. So Harford County Health Department has this program for not only colorectal cancer, but for breast, cervical, and lung screenings. And we actually take in patients that are underinsured and uninsured, 45 and over, who meet an income eligibility. And they have a nurse case manager walk them through the steps of having a colonoscopy. It includes the office visit appointments and thoroughly through the entire process until, you know, even diagnosing them with hemorrhoids or whatever else is going on.
Yeah.
And they get total care, and we just really take them in, and every patient is really important, all their concerns. We try to direct our care towards, you know, language barriers. We do everything we can to get them screened and make them feel comfortable. I think education is very important to give them power in taking care of their health. And it really, there's somebody there to answer their questions and walk them through from, reminder calls to, you have an office visit appointment tomorrow, to, what does this mean for me and what's the next step? So that's what the program does.
That's great, and it's probably very helpful to have like a nurse just like you to kind of walk them through again that step until they get to that actual appointment, and just kind of fill them with that just power that they can go through this and everything will be okay.
Yeah.
So that's awesome. In both of your experience, what's the most effective thing we could do just as a health department to increase awareness of colorectal cancer, cancer screening rates, things like that? So what could we do? So, we're here today talking about it, but what are some additional steps we can do to kind of raise that awareness and get people more into screening?
I really think it's important for people to talk about it. It's not taboo, and we all need to be doing it. We all have to have a colonoscopy. So if you've had it, talk to your friends, let them know about this program. It's, it takes about 10 years for a polyp to develop into cancer. So you have a huge window to take care of yourself, and it's really important to, it's easy for me to sit here and say it's not a big deal. It's 2 days. Honestly, you don't eat for one day, you do the prep, and then the colonoscopy takes about 6 to 8 minutes,
Wow.
and then you're done.
It is really quick.
Yeah,
People probably think it might take eternity, especially if you're.
It takes 6 or 7.
Yeah, I mean, that's the important fact. I think the education and get the word out, the colonoscopy. And one of the risk factors I did not mention is when we, as a clinician, see patients to evaluate with the symptoms to see if there's colon cancer, the first thing we ask, which is a very high risk factor, is have you ever had a colonoscopy within the last 5 to 10 years? And many times, if the patients have never had a colonoscopy, that really raises red flag from our end.
Okay.
So, and not having symptom does not mean that you don't have it. So therefore, even if you are not having any symptoms, that's what the screening is for, getting it regularly so you don't have to worry about it. And colonoscopy, the worst part is the day before, not eating, fasting, and clear liquid. But most of the patients who going through their first time, they say, wow, it was not bad. I should have done it earlier.
So I would definitely not be able to go through further without just really actually talking about COVID-19 and how that actually affected just our health world in general. And I was wondering if we could talk about how it probably affected screening rates for colorectal cancer. Did it improve it? Has it brought down? What can we talk about with like the connection between COVID-19 and colorectal cancer?
Well, definitely COVID-19, the pandemic has shook us all in worldwide and countrywide as well as Harford County. It's because of twofold. Number one is from the patient themselves. They were afraid of being exposed to this COVID. Therefore, they pretty much just stopped getting all the screening tests. And from the provider side of it, because our endoscopy center was on restricted, doing only emergent cases. Therefore, all the screening cases were elective. And as a physician, we continue to work, but mostly in the hospital, taking care of the sick patients. Therefore, the rate of the screening colonoscopy has gone down significantly. Okay. But luckily, now it's slowly booming back up.
I did some research and it was surprising. They said that 80% of all colonoscopies and cancer prevention, tests from March and to June 2020, there were 80% were canceled. And also, as far as our program, they said 12 million people in the U.S. lost their employee benefits, their health insurance. So COVID really has affected worldwide everyone, but definitely their cancer prevention and screening. So hopefully we can get things going and get all those people that didn't get screened. They're pretty backlogged. We really need to catch up. Yeah. But it's surprising at the rates of, the 80%. That's huge. We missed so many people.
And it's good that we have this program at the health department so that if you are underinsured or not insured, you can come to us at the health department and you could, work on getting screened.
No cost colonoscopies. There's there's nothing to it. You know, call us up. We'll take care of you.
Although you provide all the preparation
we
kit as
do
well.
everything.
Yes,
we provide the, you know, we pay for the prescription and, you know, the anesthesia.
Wow.
It's a great program. We love our patients.
And so I know we've been talking about, you know, testing and screening. How about the treatment options for people who don't have insurance? Is there someone that could help us provide treatment with that, or help with treatment?
I mean, after, if they're diagnosed with?
Yes.
We do have resources that we give them, and, you know, we help them find either find insurance, or there's cancer funds that we can, and we also hook them up with, and we also work with some nonprofit organizations.
Wow,
So
that's great.
yeah.
So again, more help from the health department. And so how about, what would you say to someone, you know, who might be on the fence about having a colonoscopy and getting checked for colorectal cancer? What would you say to that person to kind of get them, you know, push to get that screening and that treatment?
I mean, we don't want to push the colonoscopy the only way. As I explained, there's several alternative options. But sometimes we ask directly, what stops you from having colonoscopy? A lot of that is because of not knowing what that it involves, and not knowing anybody, their family or relatives going through. Once they realize it's not so bad. But you know, there are other alternative, easier alternatives, such as stool-based testing, sometimes imaging studies, if they are concerned about possible overall health condition and medical conditions and possible risk for the anesthesia or sedations, which is very small, but is still there. So then there's a non-invasive way of getting it done, such as stool studies. But we have to realize that if there's a second, the two-step studies, such as stool studies and imaging studies, if they show something, then you have to be willing to undergo more diagnostic and potentially therapeutic procedures, such as colonoscopy, so we can remove those polyps.
So those ways kind of just ease it in, but they might eventually still have to get a colonoscopy still at the end of the day.
Maybe, maybe not. If the screening test is negative, they may not need it for quite some time. Although the interval of between screening tests of non-colonoscopy methods is a little bit shorter.
Okay.
Like stool tests is every year or sometimes every 3 years. It depends on what modality you use. But once you get a colonoscopy and then no polyps detected, and as long as you are asymptomatic, standard guideline is every 10 years. That's once a decade.
Okay. Is there anything else that you guys would like to add for today's show?
I think this is a great opportunity to at least to talk about it and have people to be they're educated about it and what does this involve. Once they're more familiar with it, I think they'll more accept that it is acceptable the diagnostic studies. So I think the more we talk about it, I think the better it is, and especially with the colorectal cancer program, like CPAS program, it has been excellent helping everybody and just, you know, kind of ease the patient's mind.
Yeah, I just wanted to say I think it's really important to have the screening test because you can't change time, and your family needs you, your grandchildren need you, they need to, you know, have you there. So, and it's really one day, actually one morning, 7-8 minutes of your morning, you can do this. And, you know, it's, the thought process can be overwhelming, but it's not. You have people here to support you and help you through it, and we got your back, you know.
How lucky are the residents of Harford County to have people like you who can help them throughout the process and kind of make them feel more at ease for something that can be really tough to talk about and to deal with. So I thank you both for, you know, being there and being that that help for people here, for the residents for Harford County.
Great.
Thanks. So that's all we have for today, and I'd like to thank my guests, Megan and Dr. Park. And if you'd like more information on colorectal cancer and the CPAS program, please refer to the resources page right after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
service by Harford Cable Network, your county connection.